I'm Dr. Paul Canali. I've spent over 25 years in practice, and a lot of those years have been involved in research and trying to look for unification. What we call the Unification Project is trying to get many different disciplines, individual disciplines and therapies together to find common understandings or consilience of understanding. Breathe in. Remember, get him to breathe. I spent many years involving different areas of research, including the hypothalamus pituitary adrenal axis and stress responses, and autonomic nervous system regulation and limbic nervous system regulation, but really looking at therapies, particularly therapies that deal with some type of sensory processing, sensory or afferent signals or stimulations that come into the body, which led us to our big breakthroughs in the treatment of anxiety and, say, post-traumatic stress. Post-traumatic stress or traumatic stress, anxiety, and chronic pain, we know today share similar structures in the brain, right, and the nervous system. So if you can change them, you can help millions and millions of people's lives. And we use post-traumatic stress as an example because we believe it serves as an example in understanding a wide range of pathology across the board, whether it's somatization or dissociation or other forms of dysregulation. The fascinating thing is that there's this sensory information that comes in that disrupts the information. Breathe in, bring the knees together.
Yeah, we see across the board many different people with different conditions come in. Some people have come in to support they have cancer. Many of our therapists report that people lose 20, 30, 40, 50 pounds of weight without dieting.
Which was surprising to me. One of my first clients was overweight. In the past, I guess, 8 or 9 months, has lost 50 pounds. But then I started to see weight loss in other clients. What happens is the weight drops off here after a while. Some people know that, but some people might not come in just for that. They wouldn't know, but yes, that is one of the effects of this therapy, because as things balance, then people's systems balance out and the body goes back to a normal weight.
How is that possible? Because that brain and this brain reconnects.
Okay, so Dylan, take a nice deep breath in. We have a lot of people who've had trauma of all sorts, whether it be emotional or physical. We've had many people with panic or anxiety disorders, depression.
And depression may be, in many cases it absolutely is, a normal reaction to an abnormal situation. When we are subjected, human beings are subjected to stressful or painful stimuli, a common survival tool is to check out, to dissociate, right? That's one type. But then we've discovered a fascinating new type, and that's called somatic dissociation. Somatic dissociation is not only just zoning out mentally, but it's zoning out bodily. Depression very often is resolve what's going on in you. You are not happy with your life. That is a good thing. Find your purpose. You're not happy in this present situation or relationship. This is a good thing. We believe that we are on a unified theory that will explain the processes of healthcare and the very dynamic of human evolution and consciousness. Can you imagine if we can change the response of fear in the body? We have found a doorway, a computer. How do we do that? Remember, at any one time, if it really gets too scary or too frightening, we can always stop. There's a certain way to stimulating and sedating the autonomic nervous system in a specific way. We can recreate almost any feeling, sensations, physical and emotional memory in a safe environment. They can condition their body by introducing a stress and letting it recover, introducing more stress and letting it recover, to eventually they overcome those reactions.
So if you get the fundamentals on how to make the person feel safe, how to regulate the amount of stimulation you're giving so that they don't get overwhelmed to the point where they shut down, you know, and you begin to feel that. It's like balancing something very fragile.
And in the same way, we're able to engage and develop a way to empty the bank, so to speak, of this aberrant sensory pathways that occur in the brain and the nervous system, and to create what we call re-regulation.
I had been to traditional chiropractors, and it was basically, they were doing something to me. They were doing manipulations to me, but I really wasn't involved in the process. What I feel was more like the root of the pain. For me, it was a lot of repressed emotion.
Something I thought was rather innocuous in my past was actually pretty significant. I never realized what a hold they had on me, and the consequences of holding everything in. Several surgeries, a recent bout with cancer, all the way down to maybe even affecting the birth of my son. And it could have been all a result of something that I was holding way down deep in there a long time ago. But I'm not holding on to it, and that's key. I can feel it now, and feel the ugliest pain I think I'd ever experienced. And at the end of it, once I connected with it, once I understood it, it actually felt good.
What's fascinating is we can take any individual, be it emotional, say it's anxiety, depression, say it's a physical condition where they say, well, you know, I've had this incredible pain. At the moment, I'm not experiencing it. But when it comes up, it's crippling. You can recreate it on the table for them. I mean, that's a really important thing, to recreate something and show them, I'll bring it up for you. Then their whole idea about it changes, and they're able to interact with it and overcome it and take it away. So for instance, in post-traumatic stress, where the system is, there's a lot of dissociation, somatic dissociation, hyperarousal, intrusive memories. The person is really, really afraid that at any given moment something could go wrong, and they don't have any kind of control over the system.
I'm in the car and I've just been hit.
We can recreate in a safe environment the arousal states and return it to baseline, return it to vagal control. So just as quickly as we speed things up, we can turn it off. And by doing that, we build strength in the system.
I've never felt better. I'd need to learn more, and I need to share it. Because once you experience this, it is almost a duty to try and learn and try and pass it on.
But you must have a sound base of understanding of what we're talking about. It's not some woo-woo method or technique. It's really grounded on highly reproducible methods and science. If you get it right, the world will come to your door, I promise you. But you also must prepare yourself for the amount of truth that you're going to see, because people carry stories. Breathe in.
Had a tremendous amount of pain, and gosh, I've seen 70+ doctors from Tennessee all the way down here. I keep feeling like my mind is convincing my body to freeze and go back to the state that I'm used to going back to for the last 30 years. Every couple of days I was in the hospital, or I would have to have somebody help me change, shower. After seeing you, I had 3 days that were pretty decent, and I hadn't experienced that at all in over a year, so that was pretty phenomenal.
All I know is it saved my life. I couldn't move. My body was stiff. I never even felt my body. And it's just like I'm letting go of horrific abuse, which I hadn't even remembered.
Accessing emotions that are deep, especially those that seem are, you know, most of the time we all go in and what we encounter is fear. There's a fear, a deep fear of something. And it's really the last thing anybody wants to feel. I mean, who wants to know that it's important for you to go through the fear, but There's just no other way. You can't go around it, you have to go through it. So you have to really build a person's sort of knowledge and endurance.
Pain to us is a good thing. Suffering to us, I'm sorry, I've changed my whole perspective, is a good thing. Why is it a good thing? Because it's an opportunity for growth and change. The suffering is a great teacher.
And trust in the process that it's okay to feel your fear. It's okay to go in there and really feel what's there, the emotion that's underneath it, the physical feelings that go with it, any of the spontaneous involuntary movements of the body. I mean, just that is really hard for most people to really accept, is that, oh, my hand could move without me initiating it, there must be something wrong, you know, or my stomach could be bubbling with a certain activity that I'm not initiating. That's scary, there must be something wrong. So we really have to re-educate people that, no, this is good. This is you surrendering to a much larger process that you're capable of interacting with.
It's not the shaking and the vibration that frees the person, it's the process. But byproduct of the process, and depending, again, what the condition is that you're going to get the shaking and trembling. That's part of the system rebalancing.
And all of a sudden, you realize how powerful your system really is, and you come over time to trust it.
The discovery that humans possess a somatoautonomic balancing reflex, as we call it, is phenomenal. That we as Homo sapiens, as human beings, have ability to right and balance our own body, our own mind, our own spirit.
And it's easy to come away with a session of, okay, it's all dissipation and it's all shaking and sunshine, and you get off the table and you leave and everything's fine. But it's hard work.
It's a means of developing yourself, like really forever. People say, okay, aren't I better? And it's not about being better, it's not about fixing yourself, it's about being attuned to yourself and being aware in your body and feeling okay to be who you are in your body. And once you can get to that point and stuff comes up, you just work through it.
And we as human beings realize today that the very evolutionary process is something that is done by consciousness alone. We don't need greater strength anymore, or speed, or keenness of eyesight, but that our very evolutionary survival depends on the development of these higher processes.
My whole life has changed since the work.
But I'm reconnecting with the person that I liked a long time ago.
We're seeing so much happen at this point, and we've developed our way of working to a very high level where it's really reproducible now and consistent, and pretty much everyone that comes in, no matter what the condition is that they're bringing, we find a way into the system and we find that we have these responses.
So we're presenting this film to individuals and professionals to create a collaboration, to share this information, to understand if what we're saying is really true, how big an impact it could be. So we're hoping to reach out to other individuals to understand that, so that to see how big an impact this could make if we collaborate together.